Well, have you ever kind of felt under the weather or wondered about maybe some of the studies we read here on Good Morning Arizona and thought, gosh, I'd love to ask my doctor about that? Well, it turns out lots of doctors are interacting with their patients this way. We have naturopathic Dr. Sunil Jain here this morning to help us kind of understand how all of this works. I know that you do this with some of your patients. Good morning.
Good morning.
So we brought up your Facebook page. We've also got your Twitter page here. But this is something that you do. I mean, when a study is revealed, you're able to get on some of the social networking sites and kind of tool around and respond to some of your patients.
Yeah, we use Twitter and Facebook for a lot of different reasons. Basically, interacting with the patients, posting health news, various health topics, some specials in the office. But it's really a great way to interact with the patients, kind of in an informal way.
Well, what I like too, I mean, you're able to put a shorter URL here too, and you're able to kind of simplify some of these things. I mean, when it comes to health news, we all have so much access to information now, and when we can get your approval, if you're our doctor, that certainly helps.
Absolutely, yes. You know, you could also, you can kind of critique it, or you can give your own spin on it, maybe some alternative suggestions, so on and so forth. So really, it's a great platform for interaction.
I want to bring in one of your patients, and her name is Christine Singh. Thanks for coming in.
Hello.
How has this helped you?
Oh, well, I find it very useful because he posts more recent articles, and I can give my opinion on what I think of it,
Sure.
but then he'll respond to say, hey, you're accurate, you're not. But it gives me the access to the most current information.
Now, I definitely want to address this because I would imagine a lot of people are thinking, oh, that could be kind of scary. There could be a liability issue here. You're not actually doing this to treat patients.
Correct, yeah. We're not doing any diagnosing or treating. We're just kind of giving some general information, general thoughts. Again, just more opinions about current health topics and health news.
Okay, and when it comes to people who might be listening this morning, are there some areas of the medical field and some areas of expertise people should not be venturing into? I mean, are there some things that are just not appropriate to ask your doctor online?
Well, I mean, yeah, obviously there's quite a few things, but you don't want to ask anything that's too personal or something that could violate someone else's health privacy, because that's very important.
Right, there's something called HIPAA.
Right, exactly. So it's very, the questions are more generic, and it's more for informational type things.
Okay, so just to give you an example here, in case you're going, well, I would like to do that. And Christine, you actually did chime in on this. This was about something called health, freedom, government intervention, and hypocrisy. And you did chime in. And so you read this, obviously, and you say, I agree, the FDA and drug companies are not interested in anything not developed or funded by a big drug company, and it goes on. And what's so great, really, truly about social networking is we can all share our opinions, and it feels like there is a community that's developing there, and it's really great when we can share information that helps other people.
Exactly. It's just, you hit it right on the head right there with the community. You're talking about like-minded people, talking about similar topics, with similar interests, and who can kind of join in, and the power's in the masses.
There you go. Well, thank you very much. We appreciate your time this morning.
Thank you.
Getting a new perspective there. April?